Okay, we'll get started with the effects of prescription drugs while pregnant. So it is important to remember that anything that a pregnant woman ingests is going to affect the fetus either in a positive or a negative effect. It is also important to remember that a woman should not start or stop taking any medication that they need without first consulting with their doctor. In some cases, pregnant women must take medication to treat their health conditions. It is important to discuss with their doctor the possible risk and the benefits of the medication being considered. Moving on to the next slide, we have common prescription drugs abused while pregnant. These are opiates, usually prescribed to treat pain and sometimes used as a pre-anesthetic. We also have CNS suppressants, which is for the central nervous system, and it is prescribed to treat anxiety and sleep disorders. We also have stimulants, which are used to prescribe narcolepsy and attention deficiency hyperactivity disorder, also known as ADHD. Moving on to the next slide, we have popular drugs harmful for your baby. These include morphine and Demerol, which are used to relieve severe to moderate pain. This is a category C. We also have Tylenol with codeine, used for mild to moderately severe pain, also category C. We have Xanax, used to treat anxiety and panic disorders, also category C. We have Valium, labeled for use while pregnancy, used to treat anxiety disorders and alcohol withdrawal, also as a category C. We have Ritalin, used to treat anxiety deficiency hyperactive disorders, also labeled as category C. And we have oxycodone, used to relieve moderate to severe pain for an extended amount of time, labeled as category B. So now we're going to move on to the next slide, and this is going to tell you the classifications of the categories. So we're only going to go on to the categories that were labeled, which is B, C, and D. Category B, this is animal studies show no risk, but there are no control studies on pregnant women. Category C is about animal studies have shown risk to the fetus. So there are no control studies in the woman, or studies in women and animals are not available. Medications who get this classification indicate that there is insufficient data on it used during pregnancy. It could either be safe or it can be harmful to your baby. We also have category D. This is a positive evidence of potential fetal risk, but the benefits from use in pregnancy women may be acceptable despite the risk. This is where it comes in if women need to take medication in order to treat an illness or health benefits that they have. We also have problems and complications during pregnancy with prescription drugs. Some of the common problems are contractions of the uterus, which can affect the blood supply to the baby or cause preterm labor and birth. We also have interference with normal prenatal development that can lead to birth defects or the fetal dismiss. We have interference with the function of the placenta, which supplies oxygen and nutrients to the baby, causing some babies to be underdeveloped and underweight. And if you find it too difficult to stop taking any medication, seek help by calling the National Alcohol and Drug Dependency Hotline at 1-800-NCA-CALL. We also have more resources and more information by the Organization of Technology Information Specialists, also known as OTIS, or the Lactic Med. This is a database for medication women might be exposed to while breastfeeding. Or we have the CDC, activities focused on medication and pregnancy, and initiative is called Treating for Two Safety Medications Used in Pregnancy.